Hi, I would like to appreciate your attendance for today's presentation. Let me share the screen with you and making a PowerPoint presentation mode. Share the screen and make it presentation. All right, let's get started. My name is Heum Cho, and I'm an associate professor in instructional design, development, and evaluation program at Syracuse University. Again, I would like to thank you for your attending my presentation. The topic of today's presentation is development of a mental health app in South Korea. As you see, the number of the mental health app is likely to exceed 20,000 as of 2025. One potential use of mental health app is in early intervention. When in-person counseling is unavailable or take too long to obtain it, mental health app can be used as an alternative approach before individuals develop the severe symptoms. Despite the great potential of mobile applications as a psychological aid, a few concerns have been raised by researchers, such as many researchers doubt the validity of existing apps. And second one is development process are often unclear. A third one is lack of evidence-based content is widespread out. The last one is many development apps are not designed with the users in mind, leading to poor usability and low engagement. Carefully designed and developed mental health are important in improving the emotional and psychological issues of users. Most of all, the process of developing mental health app is rarely shared among researchers and practitioners, and even small-scale formative evaluation studies of mental health apps are rarely conducted. With that in mind, this is the Korean context. Koreans have been exposed to many natural, such as earthquake and man-made disasters, as well as epidemic and pandemic, such as COVID-19. Many adults report higher rates of depression, stress, somatic symptoms, anxiety, and even suicidal ideation after the events. Unfortunately, no mental health app is available to help people understand and improve their symptoms after difficult and stressful event. So with that in mind, our project goals are very straightforward. The current project was intended to enhance public mental health in South Korea and develop a valid and reliable mobile mental health app for people in South Korea. Document the process of developing a mobile mental health app so people who are interested in this process, they can replicate our study. And essentially, it provides opportunity for early intervention and broad accessibility, especially among people in young adults who needs the help. We used ADDIE, analysis, design, development, implementation, and evaluation, an instructional system design model to both develop and describe the entire process of designing, developing, and evaluating our mental health app. ADDIE is one of the models that most widely used in the field of instructional design, and it is increasingly being adopted in the medical field. The analysis phase involved defining the learning goals. The design phase involved designing the content to address those learning goals. The development phase involved developing the learning content into the format of the target technology, in this case, mobile applications. The implementation phase tests the developed mobile app with the target audience. And finally, the evaluation phase assesses user experience and effects of the mobile app. Let me tell you each phase more specifically and address how we approach these issues in each phase. Analysis phase. In the analysis phase, we invited focus group consisting of multiple counselors, mental health center directors in South Korea, researchers, and graduate students. We asked four fundamental question, open-ended questions to the people participating in a focus group. The questions are, what are the common mental health issues you encounter in your center? Could a mobile app help to alleviate the mental health issues for your clients? What type of information would need to be included to address your client's mental health issues? What could be the advantages or disadvantages of using mobile health app? So we ask these questions to the focus group. And at the same time, we did analyze existing mobile apps widely available in the United States or worldwide. The examples are PTSD Coach and Psychological First Aid Guideline to identify the types of menus, information structures, and interface they are adapting. And based on the literature review and focus group interviews, and then our own analysis of the PTSD psychological first aid analysis, we decided to develop a general mental health app for a widespread Korean audience to cover both short and long-term mental health symptoms, diagnosis tool, and feedback. So here are 5 objectives of the mobile app we are going to develop. Number 1 is to help users develop an understanding of the natural reaction to extreme events. Number 2, to self-assess both short-term and long-term mental health symptoms. Number 3, to help users take care of their mental health symptoms. Number 4, to help users take care of mental health symptoms of others. Number 5, to raise user awareness about available certified resources to support in dealing with mental health symptoms. Here are 5 menus we considered in the design phase. To achieve 5 goals, we designed 5 menus, and each menu addressed each goal I presented in previous slide. So number 1 is understanding stress reaction. Number 2 is self-assessment. Number 3 is self-care practice. Number 4 is other care practice. The last one is available resource. Let me tell you about detail the purpose of each menu. Understanding stress reaction menu is designed to provide information about the physical and social emotional reactions that might be experienced after stress. Self-assessment tool is designed to assess their own emotional, physical, and psychological health. One is for symptom caused by stress that occurred within the past month, ASD, and the other is for symptoms caused by stress that occurred more than a month ago, which is PTSD. Self-care practice is designed to help users apply basic and advanced self-care practice. Other care practice menu is designed to offer information about how to take care of others who have emotional and psychological symptoms. The last menu, which is a resource, is designed to provide contact information such as email, center address, and phone number for support centers in 17 different regions in South Korea. Let me tell you a little detail about the design phase for the content of self-care and other care content. The self-care practice, as you see here, is designed to help your users apply self-care practice. Basic and advanced self-care strategies are provided. Each topic has been described in detail in this concept map. Please take a look at. The other care practice menu offer information about how to care of others who have emotional and psychological symptoms. 4 sub-menus are presented under this other care, which is attitude required for taking care of others who have the symptoms. B is advanced coping strategies. C is things to consider developing on the subject. And last sub-menu is do's and don'ts. Here is development phases. We developed and programmed our mental health app for use on Android devices. The app has text, graph, audio, and video files and hyperlinks to support mental health. 3 rounds of expert review went through to validate content and refine usability. Key refinement from the focus group was including menu renaming, wording clarity, clickable maps, iconographic, and layout consistency. Here is the finalized screen images with 5 menus as you see here. The left side is written in Korean and the right side written in English. And we conducted implementation and evaluation with 2 approaches. Let me tell you about the usability test first, and I will cover effectiveness study second. Usability test. There are total number of 21 counselors participated in this study, but among the 21, 18 completed a survey across 7 Seoul counseling centers. They were asked to use this mobile app 3 times per week for a month. And then we administered 25-item usability survey that measures navigation, content, accessibility, design development, understanding, and satisfaction. Let's take a look at a little more detail. What do I mean by usability? What do I mean by each dimension? As you see here, this is the result from the 18 participants. It has several subdivisions of usability. The first one is navigation. Navigation, one item of example is the navigation was easy to find. I find information that I want easily, things like that. And content-wise, the content in the app allowed me to understand the ways I could handle my stress, or the content is very informative. And accessibility-wise, access to the app was easy with my mobile app. There were no technical delays when reading the content with the mobile app. Design development phase-wise, the content in the app was well organized. The text was readable. The icon used in the app represent the content well, things like that. And understanding dimension-wise, after using the app, I better understand the causes of my stress. It's mostly related to content related to understanding. The second item is related to after using the app, I better understand how to handle my stress. The last dimension of usability is satisfaction. An example of satisfaction is the content of this app was appropriate for handling stress. The second item is the amount of time I spent on this app was appropriate. The third item was it was worth of my time to use the app. Another item is I would recommend that others use this app. The last item is overall, I am satisfied with the app. For your information, the usability is measured with 5-point Likert scale. Number 1 is not true at all. Number 5, it is very true. If you pay attention on the Cronbach alpha on this each dimension, it has pretty much acceptable Cronbach alpha reliable. It ranged from satisfaction 0.79 and design development 0.93. And second one, we conducted effectiveness study. For the effectiveness study, we conducted using 2 hours to visit the classroom to recruit the student participants. The first hour is used to screen the participants. So we visited 3 classrooms and recruited 50 students, representing 40 undergraduate and 10 graduate students. Their mean age of the participants is about 25.8, mostly female participants. And as I said, the first hour is used to screen the participants to assess the current degree of subjective distress experienced as a result of a specific event. The IESRK was administered. The average overall IESRK score of the 50 participants was 1.2. A standard deviation is 0.78. In particular, the average of intrusion, avoidance, and hyperarousal was 1.14, 1.12, and 1.44 respectively. Thus, the participants overall could be categorized as being in medium risk condition, and the mental health app could be helpful for all 50 participants. And the other the other hour was used to help users understand how to use the mental health. So we instructed them how to download them, how to use them. And once they download it, they were requested to use the mental health app at least 3 times per week for 2 months. And after 2 months, we also administered the same survey we conducted in pre-test compared to post-test result. These are several scales and its reliability. We used IESRK to screen the students' subjective distress status. IES has been widely used as a psychological instrument in the field of traumatic stress. A total of 22 items measure 3 subscales: intrusion with 8 items, avoidance with 8 items, and hyperarousal with 6 items. Higher scores indicate higher level of subjective distress. The second one, the severity of acute stress symptom, was measured with acute stress disorder ASD scale. The PTSD symptom severity, we used a brief self-report measure NSE-SSS PTSD developed based on DSM-5 diagnostic criteria. PTSD risk factors were measured with 11 items, which include 3 sub-factors: peritraumatic dissociation, post-traumatic negative beliefs, and poor social support. Higher score indicate higher symptom of each subscale. As you see here, time 1, time 2 Cronbach alpha scale, pretty much acceptable. An example of each item is presented in the table. Please take a look at it if you are curious about it. And let me present the symptom change. Paired sample t-test compared symptoms before and after 2 months of app use with 50 participants. Results showed statistically significant improvement across all measures, such as ASD, PTSD, PTSD risk factors. The results demonstrate statistically significant improvement in the score of all 3 tests for those who participate in this study. And qualitative feedback also sought out to further improve this mobile app. We asked 2 questions, semi-structured open-ended question. The first question was, what do you like best in the mental health app? And second question is, if one thing could be improved in the mental health app, what would suggest? We then conduct a qualitative content analysis of the 97 responses we received from the 50 participants. Please take a look at the table. Users reported that what they like best in the new mental health app was the content. Based on the frequency of each coding theme, 25 meetings were related to the interface or development itself, and 93 meetings were related to the content, especially focusing on self-care and other care. Please take a look at the theme, definition, and example. One example of self-care direct citation is, this application offered appropriate information which helped to address our immediate needs and concern without any constraint. Another qualitative feedback, because we are keeping improving these mobile applications. Compared with what users liked, a small number of users responded to the questions. Overall, most of the suggestions regarding the content focus on providing more detailed information. The users were actively looking for information and method for self-care and other care. All right, before we go to the discussions, let me briefly overview of the research and its finding. So I would like to remind you what the research is about. The purpose of the study was to describe the entire process of designing and developing a mental health app. Using the instructional design model, which is ADDIE, Analysis, Design, Development, Implementation, and Evaluation Model, we describe our process in 5 phases. 18 counselors participated in the survey usability test and highly rated the newly developed mobile app. In addition, 50 users recruited from 3 classrooms reported significantly improved in their mental health app, demonstrating the effects of mental health app on emotional and psychological symptoms. The open-ended question result demonstrate that users were positive about the developed mental health app and also suggest things to improve. Here is a discussion. Our mobile app provides a transparent and replicable blueprint for mental health app development using ADDIE model. And it demonstrates methodology for expert validation, usability testing, and formative evaluation. Because many people may not aware of or may not know how to conduct expert review, usability test, or formative evaluation. So our result demonstrate an example of how to conduct this validation test, usability test, and formative evaluation. The third contribution is this is the first publicly available free mental health app for general Korean audience developed in Korea by the time we conduct the study. And then it enhances public mental health literacy with evidence-based tool. And it increase access to support, especially for young individuals hesitant about in-person counseling. Like any other research, this research has some limitations. So one of the limitation is our user evaluation was conducted with a small number of the mental health professionals, which is 18, and potential users, which is 50. If we had enough funding and time, we could have conducted the usability test with a larger audience and different age groups to generate the result, generalize the result, sorry. And second, our analysis heavily rely on self-reported data. Collecting the log data from the mental health app would give us a better understanding of how participants use the app. Third, in the usability test, many users suggest that we embed more multimedia resources such as audio and video clips in the mental health app. If our budget allows, we definitely continue to integrate new audio and video content in the mobile app. The limitation also provide future direction of this research. Number one, test the app with a larger and more diverse age group. Number two, incorporate user log data for objective engagement analysis. Number three, continuously update with the new content, especially audio and video resource. And I would like to acknowledge many people who are involved and contribute to the development, design, and evaluation of this mobile app, like counseling centers, their directors, and participating students and interdisciplinary team representing psychology and counseling and instructional design, computer science, and developers. So far, I hope you enjoyed my presentation. But if you have any questions, please don't hesitate to reach me out. All right, let me go and try to stop this video. Again, thank you very much for your participation. I truly enjoyed presenting this result with you. If you have any questions, please don't hesitate to reach me out by email me at mhcho@syr.edu. Thank you.